more of an all-purpose favorite drill kit. The treatment plan: extract the tooth number 16, 15, and 47. American number is 2, 3, 4, and 31. This one, I'm not going to use any allograft. I'm hoping to just use a PRF. I'm going to use a drill in a reverse mode. Actually becoming my more of an all-purpose favorite drill kit because it's compact, it's small, everything's in here, and it's been working out really good. Okay, so here is the outline of what I put in here to make this kit complete. So let's talk about the case review today. Okay, the patient's name is David. This was not the case that originally I picked out for. I originally picked out a simple 1/6 implant, single tooth, a simple sinus lifting, 1 implant case. But last minute patient couldn't make it, so I had to ask this lovely gentleman to participate, and then he said sure, why not. Okay, so he's a great patient. I'm glad we have a patient tonight for us to do the surgery with. Now, this case is not straightforward, so I was a little bit hesitant whether I should be doing this surgery for the live session because it's not a 1 implant, but I'll be placing multiple implant in 2 different quadrant, and so it's a little more complex, but I think it's better than nothing, and this also is a good example of what I do in my practice in a given day of doing multiple procedures in one sitting. So let's talk about this. Okay, this patient was referred by one of my referral network, and the patient has some history and had a previous implant done elsewhere about 6 years ago, and patient lost tooth number 26 a long time ago, about 8 years ago, and as you can see, the bone and the sinus floor has dropped down, so you have a limited bone space, right? But more importantly, when a person loses a molar function in one side, what are they going to do? We're animal of adaptation, so in order to survive, we're going to learn to choose on the other side, and that's exactly what happened. And he's been chewing on his right side for many years, for the last 8 years, and what has happened, you overuse that side, and of course these teeth start to fail. Okay, some of them got into a periodontal condition, apical lesion, large restoration, and recently patients start to have a recurrent infection, fistula developing in front of a tooth number 15, which is a second premolar. And patient has a regular periodontist who's been managing the periodontal situation, but is not really improving in that particular area. So we've decided that we're going to most likely extract these teeth and hopefully to raise the sinus floors and place some implants. Okay, so that is our goal. The reason we want to remove the tooth number 47 is that it also has a very deep pocket on the mesial of the 47, and it's going to become a non-functional because we're only going to restore molar function up to the first molar. That was our decision. So the diagnosis is periodontitis advanced, recurrent fistula, vertical bone losses, deficient bone height, and patient options were 1, doing nothing. Okay, not a great option, but it's always an option. And number 2, extract and do a removable partial upper denture, which patient was not interested. And of course, we're implant center. When a patient comes to our center, and we can assume that they want implants. Okay, yeah. And of course, extraction and implant is what we decide to do for him. So the treatment plan: extract the tooth number 16, 15, and 47. American number is 2, 3, 4, and 31. And sinus lifting of both sides, and place the fixtures on the 16, 15, and 26. American number 3, 4, and 14. And do a socket grafting to fill up those empty gaps using PRF, and also do some veneer or buccal grafting as needed. This is the intraoral photos. Quad 1 here and quad 2 posterior here. Okay. And well, let's look at the CT scan a little bit together here. And as you can, if I'm activating a CT scan right here, tooth number 16, it's got about 5 millimeter bone height at the septal area. And tooth number 15, if I go over here, we've got about 7.8 millimeter on the palate, but buccal is very thin. Also 2.5. How much bone we have here? Let's take a look. 4.7 millimeter of a bone height, maybe a little bit less. Okay, so that's what we have. Okay, so what can we do? All right, so if we were to look at the 16 area, which is the first molar, okay, because we're going to take the 7s out, the second molars out, but we're not going to put an implant, we're going to put the implant on the 16 area. We have about 5 millimeter of an apical, the bone height that's available. However, what do you see right here? That is a little artery, okay? Little artery right there, okay? So my goal for the quadrant 1 posterior side is I'm going to approach the lateral window, make a hole on the side, and I'm going to do a sticky bone graft introduction, and I'm going to place 2 implants. And because there's not enough bone height and the bone is soft, I'm going to use a denser drill in a reverse mode to try to densify the bone. I'm still going to under prep it, okay? Yeah, but I'm not going to waste any bone while I'm drilling, because in a reverse mode, I am condensing and apically pushing the bone at the same time. And after, hopefully I'll get the good stability so that I can put a healing abutment and put some sticky bone around it to fill the sockets. On the left side, I'm going to try to do the crestal sinus approach, SA2, misclassification, sinus augmentation category 2. That means I'm going to try to carefully enter through the crest and trying to introduce some sinus graft material. But on this one, I'm not going to use any allograft. I'm hoping to just use a PRF as per Professor Sohn's protocol. Okay, and I'm going to use a drill in a reverse mode to introduce the PRF into the sinus and place the implant, and hopefully I will get good primary stability as well. My second weapon of choice today, besides Densabur, is going to be, of course, PRF. I'm not going to go too much time into PRF, but it's hard for me to think of other substitute that I can use besides PRF and sticky bone. It really evolutionized the way I do surgery every day. So pretty much if I'm doing any surgery, I'm drawing blood. Always, you and I, we are the solution. And we are the one who have to learn to use these tools appropriately. Okay, all right. So wish me good luck. I'll see you soon after some of these messages.